Medical Dialogues. I'm Roshni Dhal. Let's look at today's top health highlights. New research suggested that if you're already taking one blood thinner, then you don't need to take another. In fact, researchers discovered that when patients on a commonly prescribed blood thinner stop taking aspirin, the risk of bleeding complication decreases significantly. Researchers analyzed over 6,700 people treated at anticoagulation clinics across Michigan for venous thromboembolism or blood clots, as well as atrial fibrillation and irregular heart rhythm that can cause a stroke. Patients were treated with the common blood thinner, warfarin, but also took aspirin despite not having a history of heart disease. Over the course of the study intervention, aspirin use among patients decreased by 46.6%. With aspirin used less commonly, the risk of a bleeding complication dropped by 32.3%, amounting to one major bleeding event prevented per every 1,000 patients who stopped taking aspirin. Results are published in JAMA Network Open. One study reported that patients taking warfarin and aspirin for atrial fibrillation and VTE experienced more major bleeding events and had more ER visits for bleeding than those taking warfarin alone. Similar results occurred for patients taking aspirin and direct oral anticoagulants, who were found more likely to have a bleeding event but not less likely to have a blood clot. While aspirin is an incredibly important medicine, it has a less widely used role than it did a decade ago, said the authors. But with each study, we are seeing that there are far fewer cases in which patients who are already on anticoagulant are seeing benefit by adding aspirin on top of the treatment. The blood thinner they are taking is already providing some protection from clots forming. For some people, aspirin can be life-saving. Many patients who have a history of ischemic stroke, heart attack, or stent placed in the heart to improve blood flow, as well as those with a history of cardiovascular disease, benefit from the medication. Authors say that many of these people were likely taking aspirin for primary prevention of heart attack or stroke, which we now know is less effective than once believed, and no one took them off of it when they started warfarin, said the authors. These findings show how important it is to only take aspirin under the direction of your doctor and not to start taking over-the-counter medicines like aspirin until you review with your care team if the expected benefits outweighs the risk. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.